Jazzmyn. I haven't done a video in a long time. Lots of fun health stuff going on, which I will get into in another video. As you can see, I'm in the hospital right now, so I'll just talk about the situation right now. I was in Bed Bath & Beyond the other day, and a heavy box fell into my legs. It fell over into another box, and both of them went into the side of my legs, and they twisted, and I have some fracturing. My artificial knees, the stem that's in the bone, has loosened and is poking sort of almost out the side of the bone. One leg is worse than the other. Yes, it hurts. The ER did send me to a hospital that was their sister hospital, and they said, it's a good hospital. I did forewarn them. I said, listen, I have custom-made joints because they're, my joints are tiny, and they even had to custom-make the tools. So I'm not an off-the-shelf girl, so you might want to find out if they can handle a case like that. And they said, well, don't worry, if they can't, they will transfer you to the right hospital. Okay. They said, they can hopefully just do surgery right away because this is a very serious situation, and, can have some dire consequences. And I arrive, and the orthopedist that is waiting in my room, very nicely, like after, just a few moments of, hi, how are you? My name is so-and-so. I'm Dr. So-and-so. I've reviewed your records. So, would you consider doing amputation? And he says it like it's a great idea. Hey, so would you consider, going to England? I mean, it's like that. Of course, my answer was hell no, but I did give it a moment to just see kind of offer option B or C or any other options, which he didn't. And I even asked him, I said, is there anything else you wanted to suggest? I mean, seriously, why would you suggest that? Why would you suggest it first? So he said, oh, well, you have to understand, there have been some people in the past that they felt that that should have been offered as an option for them because they would have preferred it. Okay, I'm not a doctor. I do understand there are situations that require it. I do get it. If you've got your arm stuck in the cliff and you have to chew it off, you've got a gangrenous limb, there's no bringing it back. There are situations. I do understand. But you still wouldn't bring it up first. And if you brought it up, you wouldn't bring it up with a big smile and like it's going to be a great thing. You would first try to determine how might this person react to this news. When you go for a pregnancy test, they ask you before you take the test, so would this be good news or not good news? If you've ever taken an AIDS test, they do the same thing because they want to determine, are you going to jump out a window based on this news, or are you going to be stable? So to present that option like it's the only option in such a fashion is actually really inappropriate. And, the oath is do no harm, and I don't know, that can do some emotional harm. And I have to say, it did freak me out. And fortunately, I'm medically aware enough to know that it's not necessary. So it was interesting because then he wasn't very interested in the case after that. And all of the doctors were saying that I have a very complex medical case. Pretty much most of them have not seen a patient like me, which they wouldn't have. I'm from the generation of juvenile rheumatoid arthritis patients that are untreated because at the time there was no treatment. By the time the treatments came along, there are medical reasons why I can't do them. So that's bad, but it is what it is. It is a life-threatening illness. A lot of people have passed away in their early 40s to mid-40s, and so that's why a lot of doctors that are middle-aged and younger have not seen a patient like me. So therefore, they just don't know what to do with someone like that. It's like if a veterinarian got a dinosaur. are little complexities that they would never begin to think of, and often you get mismanaged in those situations because everything nowadays, especially, is about sticking people into certain boxes, and if they can't find the box that they should be in, then they just try to force you into a box that you don't really belong in. There's no critical thinking anymore for the most part. There's no out of the box thinking. So it's very good. It's very difficult to find good medical care. So when you're in a situation like this, it gets really scary because it can be mismanaged in such a way that, it can really put your life and well-being on the line. So they said on Monday they were going to have a big meeting with all the orthopedic guys and try to figure out what the heck they were going to do with me. Which already was telling me I might be in the wrong hospital. So Monday comes along after a bunch of different orthopedic people come in and say all the different kinds of ideas, even though the meeting hasn't happened yet. And I'm waiting for my breakfast. It doesn't arrive. And so then I asked them, hey, by the way, what time does breakfast arrive on Monday? And they said, oh, you're not getting breakfast because you were supposed to have surgery. I'm like, I was. And I said, yeah, no, they had scheduled you for surgery on Saturday. And on Saturday they did the scheduling. So I was like, oh, he thought he was going to get to chop me up on Monday. I got it. It would have been quick money. He probably thought, well, she's in a wheelchair. She needs help anyway. It's not like she's walking on her feet. What difference would it make? This happens to people in wheelchairs all the time. I've known a lot of people who have been taken advantage of that way. I've had it happen a bunch of times. Also, insurance can dictate a lot of your care as well. But especially when you're disabled, you're more of a target. And because at the time I happened to be by myself, I didn't come in with a bunch of people, so that can make you a target as well. Because if they don't think there's a support system around, so, although I will say, I've had situations where I had plenty of people around and still these kind of things happened. So then earlier I heard some of the staff talking outside the door about which rooms were emptied. And they said, oh, such and such patient is done. And I'm like, no, no. She was supposed to, be discharged today because she was having surgery Monday. And they're like, shh. And then they left. So sadly, I think that's what was intended by at least this surgeon. I doubt highly the whole hospital was in on that because I think they were all just trying to figure things out, and I'm sure there was a rogue situation happening. Or the guy who did speak to me on Monday had the worst bedside manner ever. He walked in and just needed to hurry and tell me all the, suggestions of how we could handle this, but really this other hospital was more appropriate, although he could do it. But really, he'd already made up his mind, and he was not wrong, that I should go to hospital for special surgery because number one, have seen patients like me. Not necessarily all their doctors have seen patients like me, but the hospital is equipped for that. They also make their own braces and splints. They do make customized joints, so it is the correct place for someone like me to go. But he was in a big hurry and was getting annoyed that it was 7 minutes now that we were talking when he really only wanted to give me 5 minutes because he had to be downstairs for surgery. And I was like, well, dude, why didn't you just come afterwards? I'm not going anywhere right now. So his suggestion was, well, maybe we'll have physical therapy come and evaluate you and see if we could discharge you to home or to a rehab while we wait for these joints to be made. And I'm like, okay, you guys have been explaining to me for days, and the emergency room explained to me that something needs to be done right away because it's dangerous and I could end up fracturing the thing all the way through, and this would be bad. So why all of a sudden are you feeling like you can just hospital air? And I said to him, well, why don't you just call a hospital for special surgery and try to arrange an emergency transfer over there? Which, of course, they came up with 10 million excuses. Why not? I think they wanted to just get this bed free, is the impression I was getting, because it's not logical that you don't try to get your patient into a safe place. Because, okay, we can't make something in time, but maybe they would get a brace for my leg so that I'm not going to break it further. So that's been a little bit of a fight. And it's been, again, that thing of trying to put me in a box because they don't understand which box to put me in. And the orthopedic people were not coming around, but they were talking to other, departments. And the physical therapy people were trying to sit there and do some kind of an evaluation, which would have determined which way I go. And I know that if I let them do that, that I'm going to be home and be in a bad situation, because definitely a rehab isn't going to accept me there because I can't be rehabbed yet because I'm injured and need surgery. So, in the end, the internal medicine doctor and a resident fought on my behalf to get them to understand that they need to do something about seeing about transferring me over to the other hospital. So, good people do exist. Um, and, there are people also that are the A student and not the A student. These guys had they get the A for the bedside manner, and they get the A for thinking out of the box. And the one guy who's a resident, he expressed his disappointment because here he wants to learn, and he's shocked at what he's seeing and how I'm being treated. So I told him, well, then you've just learned what not to do. um, so I think that's important anyway. I think it's important to see good doctors and bad doctors. I think it's good to see people make the right decisions and the wrong decisions, because that is part of how you learn. Part of it is from example. I feel really blessed that they seem to have my back. We will see what happens tomorrow, what actually really happens in the end, because they're not in the powerful position. The other guys are. Um, but I'm not going to let them transfer me to home. Not like this. I can feel how unstable the bones feel. And I'm someone who doesn't like to be in the hospital, and I don't like to be at the doctor's, and I'm pretty bad about going. So for me to be willing to be here, especially when I have stuff to do, I have other things I should be focusing on. No, it's not good. And the pain level is not good. It's not fun at all. I know I don't look like I'm in pain, but, you know, labor pains didn't necessarily bother me either, because my normal pain level is pretty high, what I deal with all the time. So I know it's difficult for people who are not suffering from a chronic pain condition. I know it's hard for them to understand that, why you can present this happy face when you really are suffering. But try to think of it this way. If you're in pain at a high level every day, if the pain comes along that's a little bit higher than that, it's not like you haven't felt that before. You've also trained yourself to put on a happy face. But if you don't experience pain but on a rare occasion, and then you get through the roof pain, obviously you're not going to be trained every day with that muscle memory to be able to react the way you need to, because you can't always be screaming and crying about pain. It makes it hurt worse. No one wants to be around you. Um, it's like anything else that you practice all the time. It just becomes second nature, and this is no different than that. You think about it like it's a skill, because it's how you have to adapt. It's how you have to function, because it's bad enough that you're suffering, but why should you suffer by being excluded? Why should you suffer by, making your own pain worse? I don't want to sit there screaming and acting that way all the time. if I can find a substitute way to respond to it by disconnecting from it and trying to focus on other things. I'm not always successful at it. Obviously, there are times that I scream loud, I cry, like these things happen. I'm only human, I can only take so much, but I also love life and I want to do things and be a part of the world. And it's annoying to have the pain, and I try my best. I really do. Sometimes you can tell, sometimes it's in my voice, sometimes, it's in my face. But it's just part of my world, and I've known other people like it, you know, and I see what people see. A friend of mine, her hip was dislocated, and no one would take her seriously in the hospital about it. She had a chronic pain condition as well. 24 hours later, they finally, took her for the x-ray, and they're like, oh, shoot, it's dislocated. Wow, you just didn't seem like you were in pain. I was like, yeah, now I get why people don't take me seriously. So, I don't know. I think it's about education all the way around. Um, let's see what happens tomorrow. That's the big, long update about what's happening. Um, if I get copies of the x-rays, I'll share them. They are, yeah, they're a lot. It's pretty scary looking what's happening there. But they're mine and I love them. So, thank you guys for being supportive, and I will let you know what happens tomorrow. Good night.